My name is Khurshid Ghani. I'm an associate professor at the University of Michigan, which is in Ann Arbor, United States. I'm a urological surgeon, and so I perform robotic surgeries for urological conditions. In the United States, for urologists, robotic prostatectomy has become a very popular procedure, and it's actually now the gold standard operation for surgical treatment of prostate cancer. And you know, it's been, for us in the United States, we adopted robotics around 2001. So we've had a long journey, you know, and we've gone from implementing the technique to standardizing the technique, and now it's done across the board. I'm here right now in India where, you know, the surgeons in India have adopted robotic surgery maybe for the last 10 years. So a little bit behind on the curve, but they're rapidly gaining a lot of experience. And so I think we are now entering a phase, especially in the United States, where we're now very interested on assessing outcomes for robotic surgery. You know, surgeons have now understood how to do it, but what's important for them, and especially more importantly for patients, is to understand what are the outcomes. You know, you can say you can do something using robotic surgery, and it has advantages, you know, less blood loss, it's a minimally invasive procedure, so the hospital stay is shorter. There's a great precision with doing it, especially for prostate cancer. That precision is important because patients want to have their prostate cancer removed, and then more importantly, have the ability to maintain their urinary function, maintain their sexual function, and so those are really important patient preferences. And what we're focused on now is understanding what are the outcomes. And so for that, you have to measure it. And so measurement is very necessary. So we've been fortunate in the state of Michigan where I work. We work in what's called a collaborative quality initiative. And the group that I represent is a group called the Michigan Urological Surgery Improvement Collaborative, which stands for MUSIC. This is a statewide group. So all the urologists in the state of Michigan has a population of around 10 million people, and all the urologists in that state, we have around 260 that are part of our collaborative, work together, share data in a collaborative atmosphere, and start to understand best practices. And one of the things that we have been doing is focused around the quality of surgery for robotics, especially for robotic prostatectomy. So, you know, how can we improve patient outcomes for robotic prostatectomy? We have been doing this for the past 5 years. Our group was set up with the main focus is that any patient in Michigan who goes to seek urological care should get the same high-level care no matter which center they go to. And so our focus has been to make Michigan the best place in the world to get prostate cancer care. And what we have established is a method of measurement. You know, we have a clinical registry, so any patient who has prostate cancer will be entered in all of these centers. We have around 44 centers in our group. Their data is entered prospectively, high-quality data. So first of all, you need to be able to capture the data, and it has to be high quality. And so then by getting the data, we analyze and we start to look at patterns of care. We start to look at practice variation, and we start to understand, you know, why does one center have a certain outcome, and why do other centers have different outcomes, and what can we learn from each other, you know? And so by understanding that practice variation, we can then develop and implement some guidelines, some, you know, standards of care that we can then set to the whole group. So we've been measuring data, you know, we've been measuring the quality of care. And in robotic surgery in particular, we've established a very novel technique and program where we have surgeons, we have what's called a video review program, where surgeons who are doing robotic prostatectomy provide videos of their operation, and those videos are then reviewed by other surgeons to assess the level of skill. We have been looking at the skill of robotic surgery because there's emerging evidence to show that surgeons who have good skill for a minimally invasive procedure, whether it be a laparoscopic or robotic, surgeons with higher skill levels have better patient outcomes. So if our focus is improving patient outcomes, while that's a multifactorial process, one aspect of that is linked to surgical skill. And so we've been trying to improve the skill level for surgeons doing robotic prostatectomy.